Hello, hello, hello. Good morning. Assalamu alaikum. You're tuned in to PTV World with World This Morning. I'm your host, Rida Shah.
Good morning. I'm Ahmed Nawaz, and today we're going to be talking about something that is, of course, very, very special, and it definitely involves the majority out there in Pakistan, and that is the youth, because I think that is where the real potential is. The Prime Minister stressed upon it, the President has highlighted as well, the government is very keen to empower them. So I think the world right now on a global stage realizes that what potential the youth possesses, and now it's their time to definitely change, you can say, bring the change, make things better, evolve with the situation that is going. But I think Rida wants to talk at the start about the COVID-19.
Exactly. This is a very looming thing that is being talked about all across the world. It is coronavirus. And you know what? Yesterday, Prime Minister Imran Khan also reiterated that the government is doing everything in its power to tackle this problem. And let's not take it as a panic. Let's not spread panic. Let's take it as a challenge, and let's together fight this menace. Because
there's responsible reporting involved in this as well. Because even yesterday, I was hearing the press conference by the Provincial Health Minister, Dr. Yasmin Rashid, where she highlighted a very important factor. She said if 100 people get infected, 80 of them, the ratio says, and the studies say that 80 of them will get better on their own. They'll be treated on their own because of their own immune system, while 20% or 20 people are those who need to be checked into the hospital. And there's, their factors are that they're of a serious age or they've got a serious illness already prevailing. And the point is that, look, 700,000 people die every year due to flu, but we don't get these flu shots. But now is the time to act, as Rida said. Very small steps. All you got to do is wash your hands. All you got to do is avoid social gatherings now.
Exactly. Social distancing, and then, avoid shaking hands. Avoid going to the malls. Avoid going to, the restaurants. Stay at home, because it's going to be a good retreat for all of you, because in our busy lives, we don't even get to self-reflect. So I think this is a great time to reflect about everything that you've done, about becoming a better human being, connecting with your family, and so much more. So do not take this as a very bad... The quarantine does not have to be a very deadly thing or does not have to be boring. It can be made interesting according to you. So without further ado, we are going to introduce our guests who, first of all, we have with us Maham Khan, who is a fashion designer and an artist and also youth leader. Hello, Maham. How are you?
I'm good.
Good morning.
Good morning.
We are so sorry for waking you up so early in the morning.
It's absolutely fine.
Well, they're never sorry to me for waking me up, but I'm glad that somebody's being, given the courtesy to be apologized to. But definitely, we've also been joined by Mr. Muaz, who's also there as a youth expert, and he's doing a lot of things, and he's also an anchor at CPEC Times as well.
Which is based in China.
Based in China. So, you got to know the difference between our youth potential and the one that we have in China. Assalamu alaikum, how are you?
Wa alaikum assalam, I'm good.
Good morning.
Good morning. Yeah.
Well, just a food for thought, our president and the foreign minister and the minister for planning and development are also in China. And definitely this is a very, very important time for China as well, where the Pakistan government has reiterated their support to the government and the people of China in these very testing times. They've just come out from COVID-19. And recently we had the president meeting the Chinese Premier Li Keqiang as well. And a lot of other engagements are definitely on the cards. Right? Talk about youth potential now. What have you got for us?
Okay, so Maham, tell us your journey. How are you empowering youth in your own way?
As an individual, I believe that the first thing that I've done in empowering the female youth, I would refer, because, as a female, I believe there are a lot of potential in the women out there and the girls out there, and it's not been addressed the way it should have been. I'm not saying that the government is not doing. We have wonderful influencers and the government is actually putting them forward, but there's a bunch of people that is not being addressed because nobody knows that they exist, right? So the first thing that I did was that I'm a part of an organization where I'm a trainer for teachers. So I've been training few teachers from the schools that are not provided with the facilities that we have in our private organizations and our private schools. So that was the first step, and I think that as an individual I've done my job by telling them that you can go out there and do all the things that we over here in cities are doing, even if you're living in a place that is a little not underprivileged, but actually, you know, they don't have the same facilities the
Yeah.
way we do, not the same buildings, the campuses and all that. So we can, you know, make the person a better person to be out there for the students or for the people out involved with them and all that.
And I think it is very important because as a teacher, you have a lot of impact on the
Yeah.
students. Because I remember the good teachers I had, they changed my life. So I think this thing that you're doing is training the teachers. It's very important. So how did you get into it? What made you realize that this is what you want to do?
To be honest, I've been very versatile when it comes to all these things. I'm fashion designer though by my degree, but I've always seen my mother working in the professional field of education. So I used to see her going on, you know, different meetings and all that. So I started with her, and I think that then I eventually it raised up when I joined an institute, and they trained me, and I got my certification from Finland. After that, what I did was that I trained the first bunch, and I realized, like, yes, I need to do this to put, you know, if I have the potential, I need to give that, I have to move it forward so they can move it forward to the children they are teaching. You know, baby steps, but you know, that do make a difference.
It does. It
Because
certainly does.
I think Rita is absolutely right that they're changing the course of destiny for so many children. And we always say that, you know, it's you need a very, very keen eye to spot a diamond in a bunch of coal. And I think that's what really counts. But Muaz, Awan, let's talk about the difference that we have. We must realize that we might not have the resources that majorly developing countries or superpowers have, but you've been in China, you've witnessed their potential as well. But we can definitely, without a doubt, without a sheer patriotism, say that Pakistan probably has the most talented youth in the world.
Yeah. Well, definitely there's no doubt about that. We have one of the most talented youth in the world, but where we are lacking is that we don't have, you know, a community. We don't work in unison, and that is where we are lacking behind in the world. In China, you have also a huge youth population, but China has really cultivated the talent and provided them with a very good ecosystem to develop. So this is one sphere where maybe you lack.
Exactly. And can you describe your journey in terms of youth empowerment and how you're working with the community that is based in China of Pakistani youth?
Well, I think I could have contributed in a lot of ways, but one of my biggest contribution is that I left Pakistan in 2011 to China when there was around 100 to 200 students in China. So I was one of the earliest
batch going there.
Growing over there. I've lived in China for 10 years. Going back, my grandfather was also living in China pre-partition. So, and then my father lived during the Cultural Revolution. So we have witnessed, generation after generation, we have witnessed the development and the transformation of China.
Yeah,
and
firsthand, I think you should document all of that because that is very interesting.
The third generation of Pakistanis serving in China.
Yeah. So, in CPEC, we have committed, Pakistan and China have committed themselves to bringing about an economic change into Pakistan. So I think the youth has the biggest share in this project, because all these projects are going to be completed in 10 to 15 years of timeline. So by that time, our youth would be in their mid-30s or let's say 40s. So this is our opportunity. So what I am doing over there is that involving with the community. We already made a community over there called the CPEC Youth Forum, where we have involved let's say 250 students in the initial stage, and we are slowly expanding them. So what we want to do is not make it a political party, because as students we cannot do any kind of political activity in any other country, but we want to promote positivism amongst the Pakistani community in China, and also how to learn from the Chinese experience.
Exactly, that is, I think,
the digital economy, their logistics, their ecosystem, the entrepreneurship, the innovation, their hard work, the work ethic. This is what we're trying to learn over there. And what we do is that every week we have lectures from fellow students who are based in Tsinghua, in Peking University, in big top-notch universities, and we call them up. We gather around 100 students, and we learn from each other. No one is a boss over there. Everyone is learning. Everyone is basically a student. and then we try to propagate whatever we learned into the students that were there, and then ultimately this knowledge will be transferred to Pakistan in an informal way, not in a formal way, because
Yeah,
yeah.
definitely. I kind of like the idea, but I guess Rida has more to say on this because you got a chance to go to China as well, and you
Yes.
witnessed the difference that we have in terms of our work-life balance, probably.
Exactly. I went to China for this Kamyab Jawan program, and it was a great experience because when this was a delegation of 100 students from Pakistan, and we were shown the Industrial Revolution, the technological advancements in China, and it was one of a kind experience. But the one thing that I learned from the Chinese people is that they do not forgo hard work. They work all time, all day, all long. Matlab, I was surprised to see that. It was really surprising for me because in Pakistan this culture is a little slow because we do not work as much as we should. So I think this is a great thing to do because you're educating youth over there about how China became a prosperous country and how to follow its footsteps. Yeah. So I think it is very important to bring that back to Pakistan and implement it on ground. So, Maham, I would like to ask is that you working for women empowerment. So, after training some women, how important do you think their role is in uplifting the organization?
Rida, I was reading a document the other day, and it said that if you empower the women with 1%, it rates the economical condition of a country with 0.3%. So that is, 1% of women, if we are educating them, we can go way far with the economical balance that we are creating in the society. Like Ma said that, and I really liked it, that we do not have the unity within the youth that we are educating. We do not have that compound, that we are one team as a whole, and we should be out there to for the prosperity and for the betterment of Pakistan.
Exactly.
So
I think people think on an individual level.
Yeah, it's not just me. It's how I am bringing better to the country that I'm living in, or how I'm bringing betterment to the society I'm living in. So if we start, if I start with a bunch of teachers, so that somehow I'm empowering the women. They further will teach women or children or young girls out there. This goes on in a chain. As a person, if I give whatever I have to the other girl or a woman out there, this will continue in chain and will go on loops. So if you can make a difference, so go ahead and do that, rather than believing that what as an individual can I do if I'm I'm one person. You in yourself are an entire package. You have to believe that you can do it as a girl. Nobody's letting you down. It's just we are believing that, oh my God, I don't have the opportunities.
But do you feel that since the last couple of years things have changed dramatically for our counterparts, because we see them being empowered more, they've got much more opportunities now, and it's good to see that they're finally realizing their own potential?
Yeah. With the, in the previous few years, yes, they have come a long way, but we have been in old shackles of ignorance for a very long time, and I believe change does not come overnight. We have to wait for it, and we have to work for it. As a team, we have to see that yes, we together can make a lot of difference. If we are giving them the opportunities, then we have to wait for their fruit as well. Rather than, change, as I said, change does not come overnight.
Yeah, definitely. I think whether the social taboos, just getting over them is a big responsibility. But I think Pakistan is a country that's got some great role models, starting from Fatima Jinnah herself. Then you've got so many examples of Bilqis Eidi. We also had our pilot, Mariam Shaheed, as well. Definitely, if we move on, we've got Malala Yousafzai, who's been inspiring so many women out there as well, especially young girls.
She's actually vying for girls' education.
And even right now, if we see then in the ranks of the governments, you've got Sania Nishtar, who I think is doing a fantastic job in just exploring that potential and then also catering for the society at the same time.
Exactly, that is very true, and I think just like Maham said, that every one of us has an individual responsibility to give back to the society. Just put it in your heads and do something about it. So Muaz, if we talk about the whole experience of leading youth over there, because you started with a little amount of Pakistani youth, and then it increased and it increased, and to know that you are part of this change, how does it feel?
It feels great because we started off, this was a social experiment. So we started with a small bunch of students, and then we found out that we all are very good at what we do, but lack of unity is something which makes us not be able to work with each other. So we had a social experiment that we first became friends, a group of people first became friends, and then we had a level of trust with each other. And then we created this kind of youth forum or organization, because then you have almost no fights with each other. You know, you work in unity, and that has really worked for us. And also talking about youth, I think Prime Minister Imran Khan has stressed about, you know, educating the youth, empowering the youth, and this is really a wild card for Pakistanis, for Pakistan, because I think if we invest enough in our youth, in 10 to 20 years, Pakistan can come back on its foot. We can you know, revitalize our economy. We can, you know, be in one of the top nations of the world, and you know our disadvantage right now is going to finish off.
Definitely, but I think Maz is right that we need to get our youth acquainted with this as well, because we're seeing a technological revolution. We talk about artificial intelligence a lot, but as he mentioned, the government has been very keen in this. Rida just mentioned one of the parts, which was the Kamyab Jawan program. Then you've got youth business loans by the Prime Minister as well. There are special loans for, and a special percentage of those are going to women around Pakistan as well. And I think this further stresses the impact that the government right now has in terms of changing the destiny of youth. And I always stress about this, Rida, that it definitely requires a lot of legislation, and now we're getting that finally.
Exactly, we are, and it's the thing is that under Kamyab Jawan program, there are so many things that you can do. You get scholarships, you get these business loans, and then you get a platform to interact with like-minded individuals, just like Muaz here is telling us. So I think this is a great time to be young in Pakistan and to explore the opportunities and to really test yourself and to bring something for Pakistan, because it is our country and we are like our green passport is our representation. So
identity,
yeah. Exactly.
And we're talking about exploring potential. Let me tell you about an individual who in the past year has been exceptionally amazing in exploring her potential, and that's the lady sitting right next to me, because she has in the past year really grown. I still remember when Rida first came onto the scene of the PTV world. I was already here, and then we saw her grow, and in the past year she's been probably over speeding.
Thank you so much, Ahmed.
But
you're too nice.
No,
what
but
do you
that's
want?
True. Probably a nice breakfast. but I'm actually telling this that you, Rida, yourself are a role model. So that you know that's why we say, because she's been excelling in programming and she's dedicated to what she's doing. And
okay, now do I have to compliment you as
no,
well?
No, not at all. I don't.
He has been my mentor, so that is why he's complimenting me, so that he gets the credit at the end.
I'd like to add over here that, you know, I'm really happy that you're excelling, and this is something which we youth have to keep in mind, that first we have to excel ourselves.
Right.
Once we excel ourselves, then as a collective, you know, youth, we can excel. We can make Pakistan excel
as a community.
As
like
a community, we all can excel.
But you do realize you don't get breakfast by saying that. That's just me. But what I want to highlight here is, and I bring this up to Mom as well, that it's about realizing that energy and the spark deep down inside you. Because let's just face it, Allah made everybody special, and all of us have that ability. So one part of what you do, whether it's teacher training or motivating the youth, is making them realize that they already have that potential.
Yes. And you know, the best part about it is that, you know, if you bring it out of them, you know, we all have something inside us. I never knew that I could do this a few years back, but now I can. I know that I can do it. So a lot of girls out there, a lot of, not just the girl, the youth out there has it inside it, and we just have to polish and bring it out. We have to encourage them to bring it out of themselves. We see a lot of influencers, we see a lot of entrepreneurs out there because somebody with something trusted them. We have to trust the people.
But what message would you like to give, if I must ask you to just give a message that you'd like to give all the youth out there, especially the women out there, like you said?
I believe that if you think that you can do something for the world out there, go ahead. You do not have to wait for the opportunity. It won't come in you have to go find it. You have to go out and explore your potential, your, you know, you have to explore yourself just to be out there as a better person for the world and for Pakistan mostly. So just explore yourself and be a better person.
Believe in yourself.
Believe in yourself, yes.
Exactly.
Don't Stop Believing was the song that got us going. Maz, what about you?
I think she actually pointed out in the right direction, and I would just like to add that as young people, we always have to be ready to take risks, and that goes part in part with what she said. we have to risk some of our, job opportunities to do something great. If you want to do something big, you have to risk, your family connections, and also sometimes your very stable job, and sometimes, whatever career you have
The
in
leap
mind.
of faith.
The leap of faith. That is very
Put
important.
all your eggs in one basket. What if it breaks?
It breaks.
Definitely, but that is Mohammed Moaz. Thank
Thank
you
you.
so much. I think we've been so inspired by both of you. And I think, like you say, that you believe in yourself, and you talk about being a whole as a
Taking
community.
risk.
Yes, taking risks and being a community is definitely what needs us going. More power to you. We wish you all the success, and that you keep on doing this, inspiring
Thank you
youth.
very much.
And definitely, because Mom's a fashion designer, so I'm sure that Rida is going to get a lot of help from
Exactly.
her
I
as well.
was thinking that. Oh my God, are you a mind reader?
Yes, a gypsy now. But definitely, like we said, youth potential is one part of the program this morning. But we're definitely going to be continuing this right after this short break. 1, 2, 3. Good morning. Welcome back to World This Morning with me, Ahmed Nawaz, and I, of course, have Rida Shah as well. Boy, do I miss Shahzad Khan and Shiza Hashmi, because the energy that they're bringing in the morning, oh, it's
Is
phenomenal.
irreplaceable.
It's phenomenal. But definitely, we're going to be seeing them very soon. And, the second part of the segment is now equally important, because I think Rida has all the science and she's going to talk about this, but this is something which we all need to take very, very seriously, considering that this can go a long way in probably, because we talked about our potential of the youth. Once this unfortunate thing comes in, that potential might just be curtailed.
Exactly. So today is 18th March. Today we are observing World Day, which is World Young Rheumatic Diseases Day. Basically, rheumatic diseases are called the diseases of the connecting tissues. So in your tendons, muscles, ligaments, bones, you experience these things. And to further talk about this, we've been joined by a rheumatologist, Miss Dr. Sadia. So Sadia, good morning. Thank you so much for being here.
Good morning, and thank you so much for giving me this opportunity to talk about this very important topic.
Exactly. So as we know that on this day we create awareness about this disease and how it affects the young people. So what can you tell us about these diseases?
First of all, I would like to give a brief introduction about the rheumatologist.
Right.
We are the doctors that we deal about the diseases of joints, muscles and ligaments, and the autoimmune connective tissue disorders, like you said. And when we talk about word arthritis, the picture normally comes in mind, okay, there's an old person sitting, holding their knees, you know. But unfortunately, this disease is also very, very common in children less than 16-year-old, and we call it juvenile idiopathic arthritis. And again, it's very common in Pakistan. It's very oftenly misdiagnosed and mistreated, and to the point where the child develops any deformity or damage of the joint.
Right.
So I think it's very important if we talk about some of the symptoms.
Exactly.
So the people who are listening, they know about the symptoms, and if there's anything present, they can contact a rheumatologist. I'm talking about inflammatory arthritis. That means there's swelling in the joints, there's inflammation. So most commonly it starts with the small joints of the hands, feet, elbow, wrist, small joints. The child normally complains that they're very lethargic, tired, they might have fever, they're slow in their growth, they're slow in their school, in their education. Sometimes they're limping, and they're not getting up in the morning. And the mothers, they think, oh, okay, there must be some reason.
He must be up late at night or something
or
like
he's
that.
probably
So
lazy.
how young a person can, how young, is it in infants as well?
Exactly. Starting from a child of a few months age up to 16 years, they can have inflammatory arthritis or juvenile arthritis. I've seen it in a few months old babies as well. Right. So we always need to keep an eye on these things. If the child is having symptoms,
indicators probably.
Indicators including joint pains and stiffness and swelling, and also if there's any sort of like rash on the body, if the eyes are red, if the child is very tired looking, lethargic. So we need to keep an eye on these autoimmune diseases. The commonest one that I've seen in Pakistan is the juvenile arthritis. Lupus, again, is something very common in children in our part of the world. Then there's a problem we call ankylosing spondylitis. That is inflammation on the backbone, on the spine.
Right.
Again, very common. And the good thing about these diseases is that if they are treated properly, on time, with the right medicines, the child can recover from it.
But since you, I'm sorry, I just have a hunch of this because you mentioned it comes even in children, like you said, you witnessed in a couple of months old. So what can we see the causes for this as well? Does that even mean that it goes even back to when the child was in the womb and some factors, whether it's genetic or diet related or anything?
Most commonly is genetic, then environmental, and in children it could be something like viral bacterial infections. Since we talked about infection, I would also like to talk about rheumatic fever here as well. Again, very common in Pakistan, very common in children. It normally starts with a throat infection, a streptococcal throat infection, and then spreads to the joint. So if the child has got fever, sore throat, is very unwell, and complaining of joint pain as well, do keep an eye for rheumatic fever. And the third disease I would like to talk about is the reactive arthritis. And the good thing about this arthritis is that it goes away once the infection is completely gone. So reactive arthritis, as the name suggests, it's arthritis as a result of some infection. It could be the gut infection, the urine infection, chest infection, anything going on in the body can cause reactive arthritis.
And if we see that in today's era there's coronavirus, and how do you think people who goes through juvenile arthritis can deal with coronavirus at the same time?
First of all, they need to know which medicines they are taking. We are giving these patients immunosuppressive medicines. Right. Common ones are like methotrexate, HCQ, cilazodine, steroids. Most of the patients, they are on these medications. Second thing is, don't need to panic. Don't stop your medications. Right. If you're feeling unwell and you're developing any symptoms of coronavirus or any other illness, like any fever, any rashes, any sore throat, anything, please talk to your doctor before stopping your medicines. Your doctor can actually guide you about it. I've heard a very positive news about some of the medicines that we use in arthritis, like HCQ and some of the biologics, that they are actually protecting against coronavirus. So if you are on medicines, don't stop them without your doctor's advice.
That is true. That is very important.
Yeah, and I think that says a lot, because the first part because at the start of the show, me and Rida started off with the COVID-19 as well. The first part is don't confuse the symptoms. That's very, very important. Look, there are a couple of indicators that highlight that God forbids you might have this disease, but it doesn't mean that even if you have one of them, it further proves that you're undergoing. So this fear factor is always there. But definitely, I think the great part about this that Dr. Sadia mentioned as well is that this can be treated.
Be diagnosed.
This can be treated
as well. Exactly. And what is the stage when it becomes too late, and how effectively can it be treated if it is diagnosed at an early stage?
You know, the joint, the human joint is a complex structure, and in a growing child, you know, the bones are growing, the joints are growing. The joint is lined by a synovial membrane that produces the fluid that lubricates the joint. It's basically the inflammation of this synovium, this lining of the joint. So once there's inflammation, it will first damage the synovium, the membrane that's producing the fluid. Then it will damage the cartilage, then the bone. So ultimately, the joint will become stiff and it will become damaged. So the aim of treatment and spreading this awareness is to treat these patients before any permanent damage has happened. So that is at very early stage. If you have any symptoms, see the doctor, start the treatment, follow the treatment plan, and your child can have a normal, healthy life. Okay.
That is
Once the child has developed, khuda na khasta, any joint deformities like most commonly hip or knee or anything, the child will be limping, child will be disabled, he won't be able to do normal activities or sports activities. So don't give your child a wheelchair or crutches. Treat them early, get them diagnosed early.
Yeah, exactly, and not to take these pains lightly. I think this is very important in today's this segment, is that if you have joint pain, if you have pains in your fingers or anything like that, do not take it seriously and consult a doctor, because it is very important, because it can lead up to something serious if it is not diagnosed
I think,
on
Rita,
time.
we have a social taboo talking to doctors. Whenever you've got something and you consider going to a doctor, you probably, the fear factor comes in, or the problem right now mostly is that every one of us thinks we're a doctor. We're not. You can't
Exactly. Google
you can't
does
treat
not make you a
everything with
doctor.
a Panadol. For God's sake, joint pain does not go away with a Panadol.
Exactly.
So stop doing these things. But Dr. Saiba, what is the common misconceptions that, or you can say the mistakes that people tend to do, and then it becomes too late?
I think for children, arthritis in children, parents, they refuse to accept a diagnosis. They say, oh, it's the disease of old people. My child can't be having the arthritis. So first thing is that they need to know that this disease can also happen in children. And once, khuda na khasta, it's out of control, it will be very difficult to save the joint. So this is one thing very important. Secondly, I would say that people need to have more awareness about these diseases, because when we talk about the diseases of heart or blood pressure or diabetes, people know they have to take medicine for the rest of their life or use insulin, for example. Same is with the diseases of bones and joints. It's something that's going on for a long time, and that will require treatment for longer periods, and people need to take treatment, medicines for longer duration. So same example I give to them. If you're taking medicine for diabetes, same is for your bones. Don't make this mistake that you're taking a painkiller, taking some haldi or something else, and you're curing your joint pains. Don't do that. Don't make this
Yeah,
mistake.
often people do that, or this is like put this turmeric in milk, just
and
have
it
it'll
will
go away.
make
Or
everything
otherwise,
better.
this dam durud concepts that are going around instead of consulting doctors.
So I wanted to ask was that because it gets really hard for the parents to experience something like that, because for a parent a child is the most precious thing.
Yeah.
So is there any community in Pakistan of parents who faces through this?
Unfortunately, no. That's what we are talking about today, to spread this awareness so that people know about these illnesses. Like you mentioned, when I tell them about the diagnosis of arthritis in children, they straight away pick up their child and go to a dam durud or something else, and they will come back to you after a couple of months or couple of years
But then
when
it's
the
too
child
late. Yeah.
has developed a permanent disability. I have a couple of patients who are young adults now, but they can't live a normal life because they had arthritis as a child, and that was not treated because there was no awareness. Their mothers thought, oh, there's dam durud or something else, or use some home remedies and tourniquets, and now they have developed chronic deformities of these joints. So please don't do that. Please don't do the same mistake. Don't give them a wheelchair.
Yeah, like Dr. Saber said as well, and I think it's equally important, like Rida said, to actually just not be aware of it, but you need to accept realities and the facts as well. Go talk to your doctor, and it has to start from the factor that probably the first step is realization. And then there needs to be I always say there needs to be a bond between you and your doctor. I don't know why we're stereotypically so disconnected.
I think this is very important, because a doctor can guide you in the right way, because this profession, they really care about people. I have many doctor friends, and the way they work 18 hours, 24 hours, 34 hours shifts. So I think this field makes you very compassionate about fellow human beings, and I think it is very important to realize that it is important to take consultations from a professional, because they're there for a reason. And if something like this, you experience something like this in your child, you should definitely go get some help.
But do you bother them a lot? Your doctor friends?
Exactly.
Then you're
That
texting
is
at every
true.
stage. Oh,
You
I
know,
had this.
my friend, she came to Dholki, and everybody started questioning her. Okay, I have a fever. Okay, I have this acne. Okay, what should I do? And you know, all her day was, you know.
Spoiled. Do you get that, Dr. Saiba?
Same,
Does that happen
exactly,
in any
same,
family
same.
weddings or functions?
Exactly, same. But most of the family, they don't listen to your advice because wo ghar ki mulki dal barabar wali, they don't listen to you.
But you're definitely surrounded by these people as well. But let's, for starters, this day is a great way of creating awareness and observing. What more do you think on part of the media or on part of doctors or even the general public out there need to do to work more towards this?
I think it's all about spreading awareness about these diseases. So I think it's a very good opportunity that you've invited me here in this show. I think media should talk more about these diseases. There should be some runs or walks or marathons about it. I think in schools we can have some learning sessions where we can teach kids about different diseases, and then we can talk about the personal hygiene and hand washing and things like that. So I think it's very important that our patients, patients and parents, they know about these diseases and they take quick action.
Right. Thank you so much, Dr. Sadia. It's always a pleasure having a doctor on that couch. I always say that doctors are superheroes. So we have a superhero right there.
Exactly.
No less than a Wonder Woman, superwoman that you are yourself, I think, making the society a better place for all of us to live in. Thank you so much for your services.
And it was really enlightening, because, we usually don't take things seriously. And when it becomes very serious, then we go to the hospital. So it's good, we should adopt this culture of, experiencing something and then going straight to the doctor, because Google won't help you. It won't diagnose your disease. It will only make it serious if you just sit at home and wait for something to happen.
And make you a hypochondriac. That does happen. Once you read about a certain illness, you think, oh my God.
Yeah. When
I've
you
got
Google
the
something,
symptoms.
you think all the diseases you have.
And you can treat them there as well, as Rida said. But definitely that does it for this morning's show, and definitely we're going to continue so many discussions like this in the near future as well. But it's important, I think the first part is realization. Take from the show today has been a couple of points, that is, believe in yourself, take that leap of faith, and definitely creating awareness about this as well. You can always catch the social media links right on your page, which is Facebook/World This Morning, Twitter/World This Morning without a G, on YouTube and Daily Motion. It's also available there. And the fabulous repeat is going to be on PTV World
at 11:05. Let me say something too. 11:05 p.m. Don't forget to watch, because this is very informative. You have to watch it.
Definitely. Okay? And Rida is going to sign off. But before that, I think Rida is just going to highlight the disease that we started from the start as well. And what we said is that you've got to take baby steps to prevent this from spreading in society.
Exactly.
And that is, of course, of the COVID-19. Wash your hands. Social.
20 seconds, and wash it properly, as it has been, as you've been seeing it on television as well. Social distancing, avoid going to public spaces, avoid shaking hands, avoid hugging. This is a good time to self-reflect.
Self-reflect, definitely. Spend a lot of time with your loved ones, but responsibly, as we say. But that being said, from me, me, Rida, and the entire team, we're going to sign off by saying 1, 2, 3.
Good morning.